So why do you need a mentor when you're treating chronic Lyme disease patients? That's the question that we're going to dive into in today's video. Hi, I'm Dr. Tom Moorcroft, and not only am I a former Lyme disease and babesiosis patient who's been fully recovered with no relapses for the past 12 years, for the past 15 years, I've been treating some of the most complicated chronic illness patients around. My journey to expertise was, very challenging, and I couldn't have done it without the support of tons of amazing people. And two people were most influential in my development, my progress, and developing the expertise that I'm known for today and that my patients benefit from. And these were my mentors, Dr. Richard Horowitz and Dr. Charles Ray Jones. The reality of developing expertise is that it takes time. It takes experience, trial and error, attending a bunch of conferences, applying the new knowledge that you get from conversations, at workshops, at those conferences, and then really buckling down and doing the hard work, right? But the thing is, there's this learning curve that can be so steep when you're trying to learn how to treat chronic Lyme patients. And for me, this is greatly decreased when you have a mentor. And that's exactly what I experienced. You see, a mentor can be a guide through the complicated questions. They share their experiences, and rather than you having to recreate the wheel all on your own, you can stand on your mentor's shoulders and then go to the next level much more easily. And I mean, after all, isn't that what we all want? We've done all this hard work. We've gotten to a level where we have a deep understanding of how to help people heal. We don't get everybody better on the first shot. And we rely on each other and our students who kind of are literally stepping up onto our shoulders to really revolutionize the diagnosis and treatment that we're working with. So it is so important that you have this mentor. In my professional development, I experienced firsthand the benefits of mentorship, which in turn meant that my patients got better care, and they got that care much sooner in my career than they would have otherwise. I saved them tons of money, and my confidence grew much more quickly than if I didn't have a mentor. So today, I want to discuss the top 6 reasons why you need a mentor if you're treating patients with chronic Lyme disease and other tick-borne infections. Number 1 on our list is diagnostic mastery. I mean, this is one of the most important things in medicine, is getting the diagnosis correct, right? I mean, treatment is often much easier if you actually know what the heck you're treating. And given the broad spectrums of symptoms that you get with chronic Lyme disease, and that it mimics so many different things, they've called Lyme disease the next great imitator. And it's so important that accurate diagnosis is achieved. But the reality is these days, it's a formidable challenge. And that's where a mentor comes in. Seasoned in navigating these complexities, they can sharpen your diagnostic acumen actually relatively quickly. And this includes refining your skills and identifying the subtle symptom patterns, like when your patient doesn't present with those classic symptoms, the ones that we were all taught in school, yet when we go out and see people. The other day, I did a post about the classic presenting symptoms of acute Lyme disease that nobody should miss. And I got many comments that like, I never had that. And instead of a swollen knee or a swollen elbow, swollen ankle, and nobody even thought about Lyme, right? So when they don't present with those classic symptoms that we're all taught to memorize, mastering the diagnosis can be really challenging. And the other aspect of this is mastering the interpretation of these intricate diagnostic tests. This is key, seeing as how there is an in-depth review of the medical literature by Stricker and Johnson, where they revealed that that two-tiered standard approach to Lyme disease testing that's recommended by pretty much everybody in the medical field is only 56% sensitive. Said another way, that means that 44% of true positives are missed. And that's just abysmal, right? Learning how to master the interpretation of these lab tests ensures a more accurate diagnosis. And this makes finding out what the true diagnosis is quicker and more cost-effective so that you can start helping your patient get on the road to recovery sooner and ensure that they experience the best results because you have the most accurate diagnosis possible. So number 2 on our top 6 is comprehensive treatment approaches. The management of chronic Lyme disease demands an integrative treatment strategy, and a mentor's expertise can illuminate the pathway to crafting these effective treatment plans. The guidance that I receive from my mentors encompassed navigating antibiotic and herbal treatment strategies, innovative symptom management techniques, and tackling co-infections or other complications so that you can truly tailor a patient-centric approach. It could literally save you years, if not decades, of trial and error, which makes your life easier and it helps your patients get their health back much more quickly. So number 3 is staying informed. With the landscape of chronic Lyme disease research and treatment constantly shifting, keeping abreast of all these advancements is crucial in being an effective clinician. However, it can be really challenging. A mentor serves as this conduit to the latest discoveries, treatment modalities, and evolving guidelines, ensuring that your practices are grounded in the most current knowledge. In the past 8 years alone, there have been more new breakthrough research papers published on Lyme disease and tick-borne co-infections probably than any other time combined in human history. I mean, it's been so exciting. I tell my patients all the time, it is amazing that so much research is being done, because often they feel left out, right? But people are out there doing the research that needs to be done. But the challenge is there's so much of it, and we've reached that critical mass that paper after paper is coming out that can change everything. I mean, there was the sequencing of Babesia duncani's genome, right? This happened in 2016. Everybody thinks we knew it for a really long time, but we didn't. But how does this affect our previously created tests? I mean, are they even testing for Babesia duncani? Are they accurate, in their result? And are we even looking at that right pathogen? And then there are these several publications on research into which medications and medication combinations, as well as herbs that were, and actually were not, effective against Lyme disease. And there's a ton of new evidence into which herbs work and don't work against Babesia duncani and Bartonella henselae. So how do you integrate this into your practice safely and effectively? Does this lab research that everyone's doing in petri dishes and test tubes even translate into your clinical practice? Did you know that the people who have been researching Babesia duncani and Babesia microti and the new treatments with atovaquone and tefenaquine not only did a study in petri dishes, but they did it in vivo in a mouse model? And then, how do you take all this information, put it together, combine what we know about the medications and herbs in your practice in a way that's evidence-based and effective? And then what about biofilms, right? I mean, emerging research is totally changing our clinical assumptions that we've made for the past several decades. Literally, Borrelia burgdorferi biofilms do not contain fibrin. Yet, why do so many of the fibrinolytic agents, enzymes that we're using work wonders in our patients? But also, why do they fail in other patients? So it's very interesting to stay up on that, but it can be challenging because there's a lot. What about, the safety and efficacy of using disulfiram, dapsone, or double dose dapsone, or even quadruple dose dapsone? We're all reading about it. We're so thankful to Dr. Ken Ligner and Dr. Richard Horowitz, respectively, for showing us the path. But how, even if we read their papers and their protocols, how do we actually navigate that in our clinical practice? This list could just go on and on. This is the value of a mentorship community, keeping up with all the latest research and clinical applications in a place where it's just summarized for you, saving you the time and the effort, creating a better work-life balance, and creating greater clinical results. And after all, isn't that why we got into medicine, is to help people get better? And number 4 on our list is community. The intricate nature of chronic Lyme disease treatment benefits greatly from a collaborative approach. And through a mentorship community, you gain access to a broad community of specialists in your field. And each person is at a different level of expertise, and they have different clinical experience and personal experience that really enriches your learning experience, helping you develop expertise much, much more quickly, because you can see and hear about other patients like tons more than you can see in a day. Rather than seeing 10 or 20 patients a day, maybe you have the clinical experience of 100 or 200 patients coming through your practice, as you're benefiting from the experience of others and also sharing with them. And this network fosters opportunities for multidisciplinary collaboration, enhancing that quality of patient care through shared expertise. One of the biggest reasons that people join my Lyme disease practitioner certification and mentorship group is that they feel alone. And they've all told me that one of those top reasons that they show up, the benefit they experience, is they no longer feel alone. Yes, they want the learning to be easier. Yes, they want their patients to get better more quickly. And yes, they're sick and tired of feeling alone, uncertain, and even scared. So before we go on to number 5 and number 6 on our list, I just want you to know that I created the Lyme Disease Practitioner Certification and Mentorship Program to address all 6 of these reasons that you need a mentor when you're treating chronic Lyme disease patients. And not only that, because I know how great it feels to not feel alone any longer, the Lyme Disease Practitioner Certification and Mentorship Program also includes a 24/7, 365 online component where we have a community support group, which means that you not only get all of your tick-borne illness diagnosis and treatment questions answered in near real time, it means that you always have the support of a community of practitioners just like you. So you never need to feel like you're alone ever again. Check out the link in the description below for more information about the Lyme Disease Practitioner Certification and Mentorship Program. And now for our number 5 reason that you need a mentor treating chronic Lyme disease patients. Number 5, emotional resilience. The prolonged journey of so many of our patients with chronic Lyme disease, coupled with the significant toll on their well-being, can be emotionally strenuous for us, the healthcare practitioner, right? A mentor provides not just a listening ear, but also the strategies for emotional resilience, enabling you to navigate patient care with compassion and empathy without succumbing to burnout. And mentorship in a community setting provides the support you need professionally and is there for you when the rest of life actually happens, right? Having close relationships with other practitioners who have similar experiences and are in similar situations creates a great bond, and you can rely on them to be there for you if and when you need it. And as a practitioner, I love helping patients, but I also love helping other doctors who are like me, because there's the joke about the jury of peers. Most doctors are like, nobody on that jury could be my peer. And our patients are amazing people that we interact with. But sometimes it's just nice to hang out with people who understand what you've been through to get to where you're at and what you deal with on an everyday basis, and just blow off some steam sometime. So community and a mentor are amazing for that. And now, number 6 on our list, navigating ethical complexities. This arena of chronic Lyme disease is fraught with debate, particularly around diagnostic and treatment paradigms. A mentor offers a guiding light through these ethical quagmires, ensuring that you maintain steadfast in delivering patient-focused care amidst all these crazy controversies, that you're upholding the highest standards of medical ethics and professionalism. Medical legal issues and concerns can be discussed and addressed in a way that covers you while you're putting your patients first, right? I'm sick and tired of CYA documenting and CYA conversations. We have to be understanding of what's going on in the law, and we have to follow the law. And we also have to have that freedom to practice the art as well as the science of medicine. My wish for all of us is to go back practicing medicine for the reason that you likely got into it in the first place, is that you want to help people. So when you're in a mentorship community with a primary mentor, they can guide you through learning how to go through the steps that you need to make sure that you're there for yourself and your family, as well as your patient. But really, this can all be done in a way that is totally patient-centered and putting the patient first, right? And some of this is, how do you create clear patient expectations? Because so many people in the chronic Lyme field have completely unrealistic expectations of the duration of their therapy, the size of the protocol, and all kinds of things like that. So there you have it, our top 6 reasons why you need a mentor if you're treating chronic Lyme disease and other tick-borne illnesses. I hope you found this valuable and had as much fun with our time together as I did. If you'd like to see more videos like this, please consider subscribing. It doesn't cost you anything, and it certainly helps me create more free content just like this for you. And make sure that you hit those bell notifications so you don't miss any of our future videos. Until next time, I'm Dr. Tom Moorcroft. Live your best life and share that joy with someone else.